Good day everyone, I am Ivan Carla Ilacandola from BSN 1Y2-3. Today, I'll be performing a written demonstration on how to take our clients' vital signs. One of the very first practical skills that we should learn as nursing students is how to take vital signs. The importance of measuring it cannot be overstated because it serves as a fundamental indicator of an individual's health status. Healthcare professionals usually collect 4 vital signs, and today I'll demonstrate how to obtain the following readings, namely body temperature, heart rate, respiratory rate, and blood pressure. These can be measured with nothing more than a few basic pieces of equipment. The paraphernalia needed are digital auxiliary thermometer for client's body temperature, cotton balls with and without alcohol for disinfection and to avoid contamination, wristwatch with a sweep second hand for client's respiratory rate and pulse rate, and lastly, stethoscope and sphygmomanometer for client's blood pressure. Before starting the procedure, let us wash our hands first using the World Health Organization technique for hand washing. Good morning, sir. I'm Ivan Carla Ilacandola, your student nurse for today.
Hello, good morning.
Can I take a look at your ID band, please? May I know your name, sir?
John Luis Signo.
Alright, how about your birthday, sir?
June 5, 2002.
Alright, sir, thank you. So for today, I'll be checking your vital signs. This includes your body temperature, heart rate, respiratory rate, and also your blood pressure. This is important for us to know any critical information about your body, and it also assess our well-being. Is it okay for you, sir, if I take your vital signs?
Yes, please.
Alright, sir. So first, sir, I'll be checking your body temperature through your auxiliary site. I'll be using a digital thermometer and put it on your armpit. This will help us to detect any illness because there are certain diseases that are characterized by a sudden change in body temperature. It is also an easy way for us to check if a fever is present. Can I proceed, sir?
Yes, please.
I'll be pulling up your sleeves for me to be able to put the thermometer. Alright, sir. Are you comfortable enough, sir? To start off, obtain the thermometer from the container. Wipe it using a cotton ball with alcohol from the bulb to the stem. After that, dry it using a cotton ball in the same manner. Check if the thermometer or the battery is functioning well. Press the button to set the thermometer, then put it on your client's armpit. Just put your arm down tightly, sir, while we wait for several minutes until the thermometer beeps, which indicates that the reading is complete. So, sir, while we are waiting, I'll be assessing your pulse rate or the number of times your heart beats in 1 full minute. So, this will help us to know if your heart is working fine. So, I'll be palpating your radial pulse located at your wrist because this is the most accessible pulse site. Can I have your arm, sir? Position your client and begin to assess the radial pulse rate. Support your client's wrist by grasping outer aspect of the thumb. Place your index and middle finger over your client's artery and palpate for the pulse. Do not use your thumb because it has its own pulse that you may feel. Apply just enough pressure so you can feel each beat. Do not push too hard or you will obstruct the blood flow. Count the pulse to 1 full minute. Take a look of the second hand on your watch as you count how many times you feel the pulse of your client. Assess the rhythm and the volume of the pulse as well. When counting, do not watch the clock continuously. Instead, concentrate on the beats of the pulse. Right after you obtain your client's pulse rate, do not remove your fingers from his wrist. Observe the chest movement while supposedly taking the radial pulse. It may be useful to assess the respiratory rate at the same time as pulse rate because this will give us a more accurate rate and minimize any subconscious influence as patients may alter their breathing if they know that they are being observed. Using again your watch, count breaths for 1 full minute. An inhalation and exhalation is counted as one respiration. This is observed with the rise and fall of the chest wall. Respiratory rate is a clinical sign that represents ventilation or the movement of air in and out of our lungs. Don't forget to observe the depth, rhythm, and the character of respiration. Alright, sir. Thank you. Your body temperature is 36.4 degrees Celsius, sir. Right after, disinfect the thermometer used. Wipe it again with cotton balls from stem to bulb. Once done, return it into its proper container. After that, wash your hands using again the World Health Organization technique for hand washing. Document the reading of the body temperature, pulse, and respiration rate, including the time, date, and method used, noting any observations. For the last one, sir, I'll be taking your blood pressure. May I know your age?
19 years old.
Are you experiencing stress right now?
No.
Are you taking up some medications?
Only vitamins.
Prior to this procedure, sir, have you engaged yourself with some sort of exercise?
No.
Alright, sir. We are supposed to wash our hands prior to taking our client's blood pressure. But because I have already done so, I will instead do a hand rub with the use of alcohol to disinfect. Alright, sir, may I ask you, whenever you take your blood pressure, what do you usually get?
It's 120 over 80.
Let me just check. Where can I get your blood pressure accurately? The other one, please. Alright, thank you so much, sir. Can I take a look your ID band again, sir? May I know your name?
It's January 2nd.
How about your birthday, sir?
June 5, 2002.
Okay, sir, thank you so much. So as I've mentioned earlier, I'll be taking your blood pressure. This is vital for the prevention and treatment of any blood pressure-related diseases. So this test is usually painless, it's simple and quick. Can I proceed, sir?
Yes, please.
I'll be pulling up your sleeve so I can start. Are you in a comfortable position, sir?
Yes.
Wrap the deflated cuff evenly around the upper arm of your client. For an adult, place lower border of the cuff approximately 1 inch above the antecubital space. You have to apply it snugly smoothly over upper arm. Next, insert earpieces of stethoscope with a forward tilt, then relocate brachial pulse and place the bell or diaphragm directly over it. Close the valve of the pump by turning the knob clockwise. Now, inflate the cuff to 30 mm of mercury above the normal systolic reading of your client. Release the valve of the cuff carefully so that the pressure decreases at the rate of 2 to 3 mm of mercury per second. Mark the first audible sound as the systolic pressure reading and the last audible sound as the diastolic one. After final sound has disappeared, deflate cuff rapidly and completely. Remove the cuff or wait for 2 minutes if you want to take a second reading. Alright, sir, your blood pressure is 120/70. Once done, put all the equipment used in their proper place. After the procedure, you need to wash your hands again using the World Health Organization technique for hand washing. This is to protect yourself and the healthcare surroundings as well from becoming contaminated with potential pathogens. Right after, document pertinent data. This promotes patient safety and quality of care. So let me state your overall vital signs, sir. For your body temperature, it is 36.4 degrees Celsius. For your pulse rate, it is 62 beats per minute. Your respiratory rate is 22 breaths per minute, and your blood pressure again is 120/70. So based on what we have obtained, all vital signs are normal and there's nothing to worry about, sir. Thank you so much for your time and God bless.